Hello, Karla.
Hi, Carolyn. How you doing?
I'm fine, thank you. It's another week of the health wrap, and we're talking
Yes.
isolation this week, huh?
Yes, isolation of across, you think about your routine and you take for granted all the things that you had been able to go to from even just running to the grocery store, the car wash, going to church, going to activities, and people are really missing those things, especially the human touch and being able to see their friends face to face. Zoom and all of this is fine, but people now want to reconnect with their family and friends.
Some of us are zoomed out. You hear me? In the news this week, you've got colleges that are stopping and starting and uh, deciding that these campus college experiences, the parties, are too much in terms of creating a space for the spread of the disease. This is Georgia, a house party that they took. It was an off campus party, but the reality is, this is dangerous. This is young people hanging out, not wearing masks, increasing the potential to spread the virus, and that's what people are concerned about. UNC, remember we talked about this last week? The
Yes.
employees were suing the Board of Regents. Look what happened. They're canceled their in-person classes, and they've got them back working their college degrees from home. But the workers said, we don't feel safe. Notre Dame, Michigan
Right.
State, all on the list of places that are having to change their minds. And this one caught my attention. I was in a sorority house when I was in college, and they have 23 members of one sorority at Oklahoma State University that have tested positive, and they've got them under quarantine in the sorority house. So this is no joke, and it is still showing itself on campuses across the country. USC here in South Carolina, they're offering students a fast saliva-based test to contain the virus. That's what they're hopeful to do. So that's going to be interesting to watch. They've got locations all over the campus where young people can go in and take this saliva based test and see what the results might be.
I wonder how they're going to encourage them to go in. We also know that the state of Massachusetts has now mandated flu shots for all students, and that's elementary all the way through college. So um, that's going to be something by being able to do that. Also, speaking of flu shots, this is a story I saw in the New York Times about fearing a twindemic. Health experts are pushing urgently for flu shots. And basically, what's going on is that they have a fear that COVID and that we're going to have this big flu season. And so right now they've already shipped the first doses of flu vaccine, and health experts are struggling over how are people going to take it. I mean, how are you going to get people who are, some of them, afraid now to go to clinics or hospitals to take it? So one suggestion that they've had is that they are actually the Center of Disease Control talking to corporate leaders to see if they will get their employees shots. And in fact, the CDC, which normally they order like 500 doses for uninsured people, this year they've ordered 9.3 doses of flu vaccine. So you can imagine what this is also going to do to hospitals when you have heavy flu and you have COVID going on. So two potential respiratory infections going on at the same time.
Absolutely. Really pay attention to getting the flu shot. If you're a regular flu shotter, then you just get in line early because I think there are going to be a lot more people that'll be doing that.
Well, here we go again. We have periodically, in fact, last week talked about what's going on in Georgia with Brian Kemp, the governor there. And last Saturday, he had a meeting, and we talked about that they were having an executive meeting, and he issued an executive order saying now that all of the different municipalities will decide who wears a mask as far as in your city. So remember the lawsuit between him and Atlanta Mayor Keisha Lance Bottoms he brought against Atlanta? They had dropped that. And so it's kind of funny because this is the same thing that we've been saying, like, let each municipality, and what she was saying, decide what's going on. So one of the parts of the executive order says that a county that has a threshold requirement, it has, if it has like 100 confirmed cases per 100,000 people over the 14 days, that they will be able to go ahead and tell people you have to wear a mask.
Only problem is I think it contributes to that pandemic of misinformation that we have been talking about all along as well. It's more confusion. Do you know which, you know, and I know you can get in your car and drive 10 minutes in Atlanta and you're in another county. So confusion. It's unfortunate.
Well, we're going to talk about isolation when we come back right after this.
In the midst of the battle against COVID-19, it's understandable that many Americans may experience heightened stress or anxiety, affecting our thoughts and emotions. But there are things we can do to stay mentally healthy during this pandemic, and resources for you and your loved ones to seek help. Hi, I'm Dr. Joshua Gordon, Director of the National Institute of Mental Health, doing my part by staying home. And here are 5 things to know about staying mentally healthy. First, try to avoid using alcohol or other drugs as coping mechanisms. They're really not all that helpful. Second, maintain routines for meals, exercise, and sleep. And try to stay active. Even 30 minutes a day of exercise will improve your outlook. Third, try exploring wellness programs like meditation, yoga, muscle relaxation, or breathing exercises. Schedule regular times for these and other healthy and relaxing activities. Fourth, reach out and connect with others for emotional support. Talk by phone to friends and family, chat outside with your neighbors while maintaining a 6-foot distance, and join virtual online gatherings to stay in touch. And fifth, seek help right away if you have trouble coping or feel overwhelmed, are using drugs or alcohol more frequently, or have suicidal thoughts. Your doctor may be able to provide a recommendation. Anyone can become overwhelmed. If you or a loved one is having thoughts of suicide, call the confidential toll-free National Suicide Prevention Lifeline at 1-800-273-TALK, available 24/7.
Yeah, I think this is like what the third weekend we have shared that information because we think it is so very important. We know that there are folks in our midst that are dealing with and battling with isolation or the feelings of isolation. And I think it's important that you know what to do. I know you've even had Dr. Sherry come on a couple of times so that we could talk about this because it is just that important. As we decided we were going to talk about it this week, a little bit more in depth, I came across a friend's post on Facebook, which I thought was interesting. She said it's been 12 weeks now since Dr. Nick, that was her husband, passed away. Being so isolated with COVID's impact in a new city means that the grief is heavier without the hugs. And I said, let me reach out to Stephanie. Let me introduce y'all to Stephanie. This is a long time friend. Stephanie Cooper, Luter. I don't even know what to say. It's good to see you. It's good to see you. And I've been chatting you up through Facebook and sending you notes and sending you love. But I appreciate you today coming on to talk because you were very candid and you've been very candid for some time now about the process of grieving and someone passing. And now you've got the combination. You've had death in the family. You've moved to a new city, new position. How are you managing all this? And you've got the degree to manage it, right? How are you managing it?
Carolyn, thank you so much for having me today. And, first of all, one of the things I wanted to share was just your compassion. As I've shared in public spaces and on social media, some of the processes I've been going through, people like you who have reached out and just said, hey, I'm here for you. You're not alone. That speaks volumes at a time when so many of us are truly isolated. You're right. My background is social work. And the last 2 years, my husband fought cancer. When he passed away in May, it was incredibly hard during a pandemic to do the things that we typically do around grief and isolation. So we had a virtual funeral, and then I moved and started a new job. I'm in a new city. Our family's starting again. And I'm telling you a couple things that have helped me through. Number one, faith, because, your faith roots you. There's a quote from Brene Brown that says, human beings, we are wired for connection. And I can't think of any other way that really emphasizes the importance of being able to connect with others. So, in the midst of a pandemic, to go through something like a significant partner loss, a complete family shift, many families are going through incredible amounts of isolation. Even if you have a loved one who may be accessing healthcare, there were several days when my husband couldn't have visitors. So what do you do when you're even in settings where you can't reach out to the people that you love? So there's a number of things that I've tried to figure out along the way. I certainly don't have the answers. I'm still in the midst of a lot of processing and grieving. And one of the first things I can say is just in this space, when we are being confronted and bombarded with so much, just pause to breathe. And to whatever the feelings you have that come up, and when you're feeling anxious or alone, to try not to push them down or push them away. Other things that have helped me tremendously have been figuring out some type of routine. Now, initially, after my husband passed, I had taken a few weeks just to navigate, his death, to navigate a move, packing, relocating to a new city. So I didn't have a routine. So I wasn't really sleeping well, wasn't eating, I wasn't on a schedule. I have a 13-year-old son, a 27-year-old daughter. So once I figured out I really need to get my rest, I need to try to get up at a certain time and move and kind of get into that routine, that helped me significantly. I love nature. I love the beauty around us, even in the midst of some really, really hard times, probably the most challenging times. And in particular, for women and women of color who are carrying often the caregiving responsibilities of our families. And so for me, getting outside for a 15 or 20-minute walk helped me to just lift my spirit and to look at the world around me and see the incredible beauty in all that's around me. Another thing that has been significant is just pausing to ask for help. Now, in social media, in certain social media platforms, I'll share a little bit more personally. And it was my way of not only updating family who live all many different places around the country, but also it was my way of letting people know, hey, here's what I'm going through. And I got so much feedback and responses in terms of people saying, thanks for sharing. This is, I felt a piece of what you're going through. You've helped to kind of normalize what this disconnection is like. There are no words. I'm still learning my new city. I say, though, that we have a village around us, and figuring out sometimes just how to tap in, how to ask for help, how to look at the beauty that is still around us, and then to look forward with hope. That's where the faith comes in, to say, this is just for a time and place right now in our lives, and we will get through this. We have to, and we'll keep rising up.
So what would you say, Stephanie, to other people? It seems like that you're doing really much better now, but what would you say to other people to make them take that step to get some help?
Yeah. My background is social work, and I think there's unfortunately a stigma, around asking for help. We have to carry stuff alone, and the mountains, we're not supposed to carry them. We're supposed to climb up a mountain with others with us. I would say for other people that, whatever process of isolation and sadness or grief, whatever you're going through is normal. Probably your feelings are normal. If you have a friend, a loved one, a family member, a community member that you feel comfortable reaching out to, so important to do that. Stay connected. One thing that does happen, especially now that physically we can't connect, I might strike up a conversation with someone at the grocery store a little bit different, right? 6 feet apart, but just asking questions and engaging a little bit. I am not by any means like a gardener, but I bought plants at, a place, and, had lots of conversations with people around how do you have things to help things to grow. So figure out ways, whether it's to read, whether it's to play music, figure out ways that you can strike up conversations with people, even amidst our social distancing and physical distancing that we have to do. And remember that as you go through this, there are going to be lessons that you can then share and pass along to someone else. So whatever hard parts we are going through, there's something that you'll walk away with that can help someone else. And they're going to need to hear your message of healing and hope.
Well, Stephanie, Carla and I are going to have to do what we used to do when we were young girls, moving from one TV job to another TV job. And when somebody got the job in Winston-Salem, you call all your people who you know, look at your Rolodex. So we're going to have to do a Rolodex for you and see who we can connect you with in Winston-Salem.
Yes.
We have some North Carolina viewers. So if y'all know some folks in Winston-Salem, Stephanie's on Facebook, say hi. Let's lift each other up and be supportive. Listen, my sister, always, you know, my heart's there, and you are in my prayers, and we'll continue to stay connected. But thank you for being with us today and sharing some really valuable information for our viewers on the Health Wrap.
Thank you for having me, and thank you for all the important information you're sharing with so many. Thank you.
Thank you, Stephanie.
Take care. Take
Bye-bye.
care. Wow, Karla, I tell you, those are, as I said, she's got like how many of major life stressors going on at one time and still just able to manage it. And so we hope we can encourage some others and make some connections for her in the new city.
Absolutely. Well, I want to tell you about this story that I saw in the LA Times about isolation. And it is a story that talks about how the pandemic for people with dementia, how difficult it is for them. And in the story, it talks about this like 91-year-old lady who had a routine that she was going through, and she had been living in her house for 60 years, knew all the neighbors, all the stores, all the little cafes and everything. So now her whole life, basically, a lot of it has stopped. And for a person with dementia, that can be devastating. So we wanted to ask an aging expert to join us today to talk about that. And this is Miss Patricia Bailey from Dallas, and she is an aging expert. She actually has a company called She Ages Well, where she develops products for therapeutic aids for people, and she has aged well. Pat, can I tell them how old you are?
Please, Karla, please, so we can go and
Okay.
that out. Let's tell that story.
Okay. So Pat is 66, and look at her. So she
But
knows what
Pat
she's talking about.
Now, Pat is proof of the Rolodex hookup, Karla, because Karla called me in Washington, D.C. and said, hey, my girlfriend Pat is coming up. You got to get with her. You need to talk with her. And we went to lunch for hours and hours. That was obviously pre-pandemic, but love you and great to see you.
Yes, welcome to the Health Wrap.
Thank you, guys. Thank you very, very much. Real interesting time now, right?
So, yeah.
Yes, we want to dive right into that because, you know, it's an interesting time. We're in the middle of this pandemic. And like I was mentioning about the lady, Miss Daisy in California, this is a hard time. And so basically, you know, people who have dementia, their routines are set and they live by that. As you know, what can we do since they need social and mental stimulation? How does this affect a person?
You know, first of all, I don't even know if everyone is conscious of how big this is. Meaning that right now, when I got involved on the caregiver advocacy side, we were dealing with 5 million people with Alzheimer's. Now we're dealing with 6 million people with Alzheimer's. And then when you take that against the actual statistics associated with the aging of America, there's 142 million people right now in the United States over the age of 50. Now, I'm not even dealing with those that are over the age of 65 and 66, that corridor that I'm living in. So when you start talking about what can I do and that there is a regimen, the thing that's interesting to me about what happened to all of us, because I believe that even as talking to you as girlfriends, we are all having moments of loneliness. We're all having disparity over the lack of touch. So here's another individual who doesn't understand what's going on in their life. And one of the things that I can honestly say is that we need to now, and that we need to embrace our new normal, and we need to plan for happy. Because in that they've already had an order and process in their life. We're really probably more challenged in saying, how can I connect with that person with dementia differently than I've ever done before? So I want you to imagine, you've talked about the church committee groups calling out. We really and truly need to commit ourselves to every weekend being something like a sanity safe checkup day, We need to go through our rosters and our own personal Rolodex and make that phone call to have that time with that individual. Because it's amazing what 5 minutes of love and care will do via the phone to a person that may extend to an hour and a half. That's something, right?
Mm-hmm.
But we need to do that across the churches. We need to do that across the community groups. We need to do that across the board because we weren't planning on being this type of separated. And we truly were not planning. The hardest part about anybody that is actually caring for someone with dementia, no one ever talks about what happy is. We do that with our children. We do that with every aspect. Why don't we do that with those that are in the state of dementia? And happy for them is meeting them where they're at.
So what about, you mentioned faith-based. I heard a lady say that she zoomed in on a choir practice for her mom. So her mom could hear the choir rehearsing because she had been a big member in the choir. What are some of the other things that we can do?
Dance. Dance and dance. Because what is most incredible about the mind is the cognitive relationship of where our memory lies. We remember the dress and the smell of that dress. We remember the dance. And one of the things when I actually had to give my mom's care over to extended caregivers associated with assisted living, I created a poster that sat on the wall that told her story so they knew what to talk to her about. They knew the names of her children. They knew that my mother was the bid whist person. Okay. She was the bid whist person. And they could talk about that. But they also had the trigger. And the trigger was, Mary, let's dance. And I said, when you do this, I have her music in her room on cue. So I got some Chubby Checker, Let's Twist Again, like we did last summer. I've got some Brooke Benton. I've got some Lou Rawls. We need to use the senses that are tied to the mind to reinforce a state of love and a state of happy. And what's incredible about that is it doesn't mean we have to go outside and do it. Yeah. It's something that we can do right here in the house. And I never got a chance to tell you guys how honored I am to be in here. And Carolyn, you and I had such great conversations about caregiving. And Karla, you and your end, you are just plain and simply creative in your caregiving language.
So Pat Bailey, thank you. We appreciate that. You know, we always, of course, the people who are the patient or the family member, but what about the caregiver? Because a lot of caregivers, you know, when we were out of the pandemic before, they would at least have one day a month that they could travel or go have lunch or whatever. So they're isolated as well.
Well, one of the things that's very powerful right now that I need all caregivers to know and hearing the sound of my voice is that caregiver support groups are still going on. So the hardest part about being in the caregiver group, this is the way this works. How do I, as a caregiver, embody the spirit of the person I'm caring for, and then embody the spirit of what I need to be cared for? So what we really and truly want to do, this is an opportunity to talk about planning, and this is an opportunity to make these phone calls that we shared, that Stephanie was sharing earlier. We need to actually be more encouraged and make that phone call. So to the Alzheimer's Association, make that call, and instead of the typical call that you would make of where is the neurologist, right? Where is the particular attorney that's going to help me with all my legal papers? Have that phone call that deals with, I've got to find a caregiver support group because they're going on in the community right now and they're doing Zoom calls. And what I love about that is just because you have that 1 hour caregiver call, it doesn't mean that you can't have your daily walk with another caregiver moment. Does that make sense? Because lonely in this process does not mean left out. In this instance, this is truly a seek and ye shall find moment, but it requires you taking the time and believing in God and knowing that we are never alone, and make that phone call.
You're so right, Pat. You're so right. Well, I was smiling a lot because you and I had, you're right, many conversations, but you'll appreciate this summer that the music piece you talk about is so easy. I had my brother go to my parents' home and look at the albums that my father used to have as a young man. And what kept coming up was John Coltrane, which, you think about it, you even know the music your parents really love, right? And so I went to Pandora on the internet. It doesn't cost you anything. Go on, set up an account, and pull John Coltrane. And then every artist related to him, including him, comes up. And that's music to sleep by, music to do activities by, and just to watch his face the first time I did that was amazing.
And you know what's interesting to that, Carolyn, to your point, imagine now going to another level and going to the back of the closet and now play dress up.
Oh,
play dress up, get the makeup out, do the hair, do it in the house. And we're getting ready to go. Where are we going? We're going to a concert in the house, Mom. We're going to a concert in the park, Dad, and set it up that way. We need to move to a lane of intentional living in the midst of this caregiver and COVID moment. And we can do this, but planning becomes important. And one of the things that I am more than willing to share, and I'll make available to you for all of your listeners, is more information on that list of these tips that we can all engage in so we can get through this process.
Absolutely. Thank you. You are always been such a giving spirit. Thank you.
My sister friend, my gorgeous sister friend. She ages well.
Yes, she does.
Thank you.
Love you.
Love you too. Take care.
I tell you what, Mr. Sawyer, being the dashing Mr. Sawyer, I bet he can hear some of that music and say, be thinking, okay.
Hey, memories. You see the twinkle in the eye and the wink, right? Yes. Well, we've got a little bit more left in the show. We've got a break, though. We'll be right back after this break.
I'm staying inside for all of our at-risk loved ones, my grandparents, your grandparents,
my friends and family, and for you.
We stay here for you. Stay home for us.
You need to stay smart. You need to stay home.
Staying at home, social distancing, all these things that CDC is saying is going to help us get over this quicker.
Every infection that we can prevent helps to keep us as providers safe, helps to keep you as a member of the public safe.
I am staying home to help slow the spread.
Do your part in making this go away.
Stay home.
In order to come together, we must stay apart.
It sounds contradictory, but it makes a lot of sense.
Tell me you love.
The first thing that I will do,
go dancing with my friends.
I'm going to hug my kids' teachers and tell them how much I appreciate them.
Stay home.
Stay home for us.
Karla, I wish I could count how many times we have heard in this show this day the word hug.
Yes, the human touch.
It is real, and it is so critically important. And so we want to leave everybody today with lots of hugs. Virtual hug to you, my friend.
Oh.
And some people will see them back in another week to watch the health wrap. We thank you for being with us, everybody. Bye.
Unafraid to be alive. You're living and you're breathing. Feels like the very first You will make your way through the valleys of your soul, coming home to the truth about the world. La, 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 la.